Hi, my name is Tiffany McGilvery. I'm in the class MFT 6102, which is called Psychopathology, Diagnosis, and Systemic Treatment. Watch the Soloist for the video. And Jamie Foxx in this video plays Nathaniel. And then we also have Robert Downey Jr. who plays Steve. And this is a true story. The first thing I want to do is give you the diagnosis that I came up with in watching the video, and that was schizophrenia. I believe that Nathaniel has schizophrenia. So I wanted to go with you over the DSM-5, and within that there is a certain criteria that Nathaniel has to meet in order for me to give him that diagnosis of schizophrenia. So the first one is A, which he must have over a month period. In this video, I'm not really sure how long, but I know it's over a month. One of them is delusions. One of them is hallucinations. One of them is disorganized speech. And one of them is a negative symptom, which is not having any motivation. B, there's a level of functioning that he does not have in a major area, which one of them is work. He is a bum. He has no desire to work, and he lives on the streets. And the other one is that he's not able to have relationships with others. He has one family member left, which is his sister, which he has no relationship with at this time. And Steve meets him and is trying to be his friend, but he's also having a hard time having a friendship with Steve. There's also E, which is he doesn't have any substance abuse or any kind of medications that I was able to see. Those two things could affect him, but the fact is I didn't see him taking any kind of medications or doing any kind of substance abuse, so therefore those would not necessarily affect him. And there's also dysphoric mood, which is anger and anxiety, and he seems to show a lot of that within this video. The other thing that I noticed is that he is unaware that he has schizophrenia, or doesn't want to believe he has schizophrenia. That's one of the reasons he does get angry, is because he does read that might be partly his issue is having schizophrenia, and he doesn't seem to like that word whatsoever, and doesn't want to believe that he has it. He doesn't have a desire to be diagnosed with that, therefore he's not taking any medications for it. So the experiences I would like to share is, one, he has delusions. An example of a delusion would be the fact that in the tunnel where he mostly stays, that there's a cigarette in the middle of the street and lots of cars going by. And he wants to, I think his delusion is his belief that no one should smoke, or no one should have a cigarette or throw it out the car. So what happens is Steve shows up, and Steve is able to save him and get him back to safety, because he will do whatever he needs to do to get that cigarette. So that would be an example of the delusion. An example of the hallucination would be that he did enter the Julian School of Arts, which is a great school. He remembers some of the people that he became friends with there. But in that, while he was there, he started to hear voices, and many of the voices were voices of his mom or his sister going back into the past. He felt scared, he felt scared of what he was beginning to experience within his mind and didn't know what it was. So therefore, because of that, he ended up dropping out of the school. With the disorganized speech that he does experience, one of the examples from the video is that there are many times that he's not able to hold any kind of a conversation with Steve. Steve wants to be his friend, and a lot of the things that he says could be facts, could be true, could not be true. There are many things that I heard that were things that made sense to me, but yet they were out of order, number one, and number two, he talked very quickly. So that would be right there an example of disorganized speech. He also has negative symptoms. So one of those is he doesn't show any kind of emotions and has a flat affect. And the other one is avolition, which what we talked about with the work, that he's not able to set goals. He's not able to have a future for himself because he can't set those goals. Throughout the Soloist and watching the video, his flat affect is basically throughout the movie. He doesn't show much emotion. He does show being scared, but he doesn't show any other kind of emotion throughout the movie. The abolition part, he really wants to learn how Graham wants to teach him more about how to play the violin, and I think part of him really wants to learn how to do that, but he stopped because he's not able to set goals. He's not able to, things that he wants, he's not able to look to the future or play the tape till the end. He doesn't know how to do that. So he doesn't make goals for himself. I now want to share with you a couple of things I found on the internet websites that give a type of description of this disorder. And the first one that I found was nimh.nih.gov. And I first want to give a definition of schizophrenia they have. It says it's a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality. Although schizophrenia is not as common as other mental health disorders, the symptoms can be very disabling. So the three symptoms that this website talks about is cognitive, negative, and positive. For the cognitive, it's some kind of it's really subtle, so you don't see it at first. But some individuals that have schizophrenia may have more severe changes than other individuals. And they have a change in their thinking, in the way that they think. So it doesn't just happen. It's a process that happens over time. One of the things is they're not able to focus, and then they're not able to remember even if they just learned something. So they could learn something and then a few minutes later not be able to tell you what they just learned. There's also negative symptoms. This is just disruptions to any normal behaviors or emotions. One example could be difficulties in starting a behavior or continuing one. Another one would be they have no expressions, or they don't have any tone as well. And also they're not able to enjoy life the way that they were once did. So you develop schizophrenia. It's not something that you're necessarily had when you were a child. She may have had more happier times possibly, but you're able to remember those times in your childhood, and it could have been negative as well. One of the other things is positive symptoms, which a person with schizophrenia would have. This is they lose touch with portions of reality. So just to give you some examples of what they have on the website, we've got delusions, we've got thought disorders, or maybe they have an unusual way of the way they think, hallucinations. We also have movement disorder, which says in there, it says agitated body movement. Didn't see that with Nathaniel necessarily in the movie, but that can be one of the symptoms. I'll also go over, they talked about ways that individuals are more at risk of having schizophrenia. One is it could be in their genes, it could be genetical. It could also be in their environment, the way they grew up. It could also be any psychological factors. And it also could be in regards to if their mom, before they were born, had any kind of malnutrition, or if she did have any malnutrition or other problems during her birth. So birth is also a big one. This is another website that I found called health.good.is. And it talks about, the topic is what it's really like to live with schizophrenia. So this is a lady who's been diagnosed for about 5 years, and she lives with schizophrenia. So these are some of the things that she has found out. 1 in 51 million people actually live with schizophrenia. She says that life can be uncomfortable at times, and also some of the symptoms are very scary to her. She also finds that people can be insensitive and say things or do things and not really think about it, and that's one of the other things that she has a hard time with, especially with those who are close to her that don't understand or don't put forth the effort to understand. She says that everything is loud, so everything that she hears is more loud than a normal person. Then she also is having voices in her head, which is also hard for her to manage at times. So this lady has found that the only way that she's actually able to quiet the voices that are in her head is by taking medications. So I would say for the majority of people that are diagnosed with schizophrenia probably need to take some kind of medication to help, especially with the voices that are in their head. She tries to educate herself every day. So she's always a work in progress. She's always looking for, it's a lifelong disease that she has, but she's always looking for a way that she can learn more about the disease, and also, I'm sure, learn about ways that she can cope with the disease. She has a lot of people that tell her that she looks normal and she looks fine, and she doesn't look like a person that would have schizophrenia. That also frustrates her, because in her mind it's like, well, what does a schizophrenic look like? You know, there's different ways. She happens to be able to have coping skills for it and puts herself together well, so she looks like she doesn't have schizophrenia, but she does. Then you have people like Nathaniel, like in the video, who are homeless. They push a shopping cart around with everything that they have or everything that they own. So every individual that has this handles it in a different way. The next thing I want to do is a treatment plan after I've done the diagnosis for Nathaniel, who's in the video. And I would want to find a model that would help him individually and also help his family. So I have chosen the cognitive theory. And I think for this patient that his sister in particular will be extremely beneficial in having this type of, using this type of theory. Schizophrenia has to do with so many thoughts, a way a person thinks, and also their behaviors, what they believe. That's one of the reasons why I think CBT would be really good in this situation. The sister, along with the individual with schizophrenia, also needs to learn some of the skills and educate herself in what schizophrenia is all about. I think that this model is going to help them both change the way of thinking about schizophrenia in a different light, in a different perspective. I think that in the cognitive theory, which has to do a lot with your thinking behaviors, I think it will also be good for the sister in this scenario to have and to find different ways to support him in having this disease, because this disease is also hard for the person that is watching the individual with schizophrenia. I think that the cognitive theory will be also beneficial to Nathan in this scenario. It seems like he makes a lot of assumptions about people, about himself, and it's mostly because of his past experiences that he's had. And to give you an example, I feel that he feels that he can't hold down a particular job. And that's why he lives on the trees. He feels like he may not be smart enough, or that he's not able to do this because of everything that's going on inside of his head. And I think that also, since the fact is he didn't actually complete, he dropped out at the Juliana Art School, that he has a belief about that with the voices that started in his head at that time. I think that also he has a belief about himself, because he knows that he might be sick, but he doesn't know what it is, and he doesn't want to know what it is. So there's a couple interventions that I would like to talk about. And I think that the interventions will help give him some hope and encouragement to his life that he has right now. And one of these is the CBT, which is the cognitive behavioral therapy. I know it will take some time, a lot of time and work for him, but I think that it would be important to gain a relationship with him. What relationship I can with him. At least gain where I can talk to him. Even though he doesn't show emotions, at least he'd be able to, if not gain a relationship with me, at least trust me, and that's going to be important. I think it's also important that he understands that I truly care about him, and that he's not just a number, that I truly want to help him. I know I'm not in Nathaniel's position with having schizophrenia, but I would want him to understand that I will try to understand what he's going through the best of my ability, even that I'm not in that same position as he's in. I would want to help him also with his coping skills. And that's going to take work on his end, I understand that. But I think learning to cope and manage with this disease is going to be really important, especially since it is a lifelong disease and something that he will have to deal with. He has a lot of thoughts and failure because of everything that he's experienced in his past and in his own mind. So I think that the coping skills will also help alleviate some of that for him as well. He may be thinking at this moment that because he has been diagnosed with schizophrenia, that he can't be successful at anything. And I think that belief comes from the disease that he has. I think that he needs to know that he actually can be successful. He can be successful in life. He can be successful at work. And yes, it's going to take a lot of work for him to get there. I believe that all of these things that Nathaniel is going through with this disease is going to be a part of the stress that he feels, any frustration or anger that he feels, the fact that he really doesn't understand what's going on with himself. Those will all be things that I would want to be able to help him with. He does find, in the movie, I do find that he does realize when he has done something that's not good. An example of that would be when he was angry with Steve because he was signing something and it had diagnosed or had the word schizophrenia in it, and that really set him off right away, and he got really angry and got really aggressive and a little bit physical with Steve, and had him get out of his apartment and let him know and told him that he doesn't want to ever see him again, and that he would cut him up like a fish. And I think that he felt sincerely he did feel bad about this, because when he and his sister went back to Lance and where he was playing his violin, and he came out and talked to Steve and they ended up shaking hands, he realized that what he'd done was wrong, and he knew that. So, which tells me that he does have some feelings, just doesn't know how to show those feelings. I believe with CBT that I'll be able to help him maybe change some of his thinking that's going on, and also help him with the behaviors that he has. This will take a lot of work for Nathan, but I think that he'll feel that it's worth it once we do that. I also think that one of the good interventions for Nathaniel would be this psychoeducation. The reason is simply that he must understand this long time disease that he has, and that he is going to have to work in order to feel better, because he will always have it. I feel he has a fear that he may have this disease, but maybe he doesn't want to admit it. And I think that learning more about it and understanding it more will help him with some of the fears that he's feeling. Nathaniel's never really had anybody explain to him what the disease schizophrenia is. So it would be important with the psychoeducation for him to learn about it, understand it, and also to not deny that he has it anymore, to realize that he has it and what he must do to make himself feel somewhat better. I think with psychoeducation that it's also important that he has this particular intervention, because not only will it help him understand what schizophrenia is, but once he does understand, I think that it will be easier to work with him on these things, like delusions and the hallucinations, voices that he hears, and some of the angry outbursts that he has. They're things that can be dealt with. It's the first step is admitting, though, that you have schizophrenia. I think that this intervention also is going to help him with some of the irrational beliefs that he has, not only about himself, but some of the beliefs that he has about other people. I think that the automatic thoughts that they have, this intervention can help, because even though many of us work on that daily and sometimes realize what our automatic thoughts is, I don't think that he realizes that, and he needs some extra help with that. I think that this will be a good place to start for him to understand more about automatic thoughts and be able to help him understand more about schizophrenia. There are several different reasons why I actually think that family therapy in itself would actually be a good for Nathaniel and for his sister in this case. I think that it's good to understand. I think it's good for me to understand and learn about this journey that we're both going through at this time. And it's both Nathaniel and his sister that are going through it. Nathaniel, the one with schizophrenia, and his sister who is more of the supporting of Nathaniel. I want to be able to help both of them, but I want to help them find a realistic way that they'll be able to handle the situation. I actually also want to help Nathaniel find a way how, because there's steps that he'll have to go through, and I want to help teach him the steps that he'll have to make in order to make any kind of changes in his thinking or any kind of changes in his behavior. Want him to be able to better his life, and then also with that also better his relationships with others, whether it's friendships or family. It can be any kind of friendship. This particular intervention will also help both of them come to an understanding of the disease and the way that each of them plays some kind of a role. Nathaniel plays a role and his sister plays a role. And they actually both have to find out how to deal with this lifelong disease called schizophrenia. His sister has to find out how she can support Nathaniel, because she's also going to be affected as well as Nathaniel. But also it's finding and helping Nathaniel not only understand, but be able to work on having a better life, maybe having a more healthier life or a well-balanced life in spite of this disease. In Nathaniel's treatment plan, I'm also going to refer him, and I'm referring him to a psychiatrist, because I know that the psychiatrist can actually give the medications that he will need to be able to focus and to be able to listen to me so that I am able to help him. And I also think that having the medication is going to help with certain symptoms that he does have having schizophrenia. It's going to help him. I think medications will help him probably hear the voices less in his head. And it'll also help him with some of the anger things that he have. I don't think it's an anger management that's the problem. I think it's that he just doesn't know when he's getting angry. He doesn't know how to control. He doesn't have coping skills. I think that's the problem. I also would communicate with the psychiatrist, not only my findings, but communicate with them about things that they may have found also, but have a relationship with them so that we're able to give Nathaniel the correct medication that will actually help him. This disorder in itself is very challenging, and it's challenging for all those who are involved. Nathaniel, who has a schizophrenia, and all the others that are trying to support him. It's going to be hard for all of them. And it's actually going to include friends and family, and his sister, who wants to support him now. She's going to have to educate herself in order to be able to support him. It's going to be really difficult for those individuals who truly want to help him and want to see him get better. These people that are trying to help him, yes, they may get frustrated And there's going to be times where they're not able to help him. And I think like in the movie, his ex-wife lets him know that the importance of that being there, just being there to support him, being his friend, and not necessarily making changes in him that they'd like to see. But I think that he recognizes, even with schizophrenia, he recognizes those that care about him and support him, and sometimes that's all we can do. Thank you.